So clinical officers across the country have started their strike. The officers downed their tools at midnight following the expiry of their 1-week notice and the failure by the Ministry of Health to address their issues. The strike has paralyzed services in level 2 to 5 hospitals across the country, further compounding the crisis of health services provision that is already reeling from the ongoing doctors' strike. Brenda Wanga has more.
A deadly silence greets those coming for health services at the Igegania Level 4 Hospital in Gatundu North constituency. It is this silence that Jacinta Wanjiku encounters as she comes to seek delivery services. She has been attending her clinics here and was due to deliver by cesarean section, but now she isn't sure anymore.
Sina uwezo sahi hata nashindwa nitafanya nini. Sasa sahi nasema hii serikali yetu ikuwe imegomoka nisishide sita sana.
She isn't the only one who hasn't been attended to by either a doctor or a clinical officer. The clinical officers are the latest to go on strike in the health sector, where limited services were being offered by this cadre of officers. Now there is none, and patients are worried sick.
Na niko na idisari moja na bado sipati daktari. Ile mtu imelete hapa ni soso na amelala kwa kiti. Tunangojea tuone kama tutapata ile mtu atatusaidia.
Wodi ya wazee, wa mama na watoto zote zimefungwa kwa sababu wale wagonjwa wataangaliwa na kina nani. Kwa hivyo kwa sasa hii hospitali hakuna mtu ambaye anachukuliwa wa kulazwa.
Henry Esiago traveled from Kisii to Kericho. He was scheduled for a hernia operation at the Kapkatet Hospital, but the ongoing biting medics and clinical officers strike has put to rest those plans, leaving the elderly patient at a crossroad.
Ajabu ni kwamba vile nimefika hospitali sioni daktari. Naona tu watu wa ofisi hizi zingine na madaktari hawako.
The strike affecting public health facilities has seen patients from across the country suffer as they are unable to access the much-needed services. A majority of them say they can't go to private hospitals, and they want the government and the medics to resolve their differences.
Usikia kilio yetu, umapatie haki yao, kulingana manatafuta haki yao. Na ni lazima kila mtu apewe haki yake.
Must appeal to the Cabinet Secretary for Health to just get out of our office, humble ourselves, go and talk to the doctors. Listen to what the doctors have to say. Because when you hear them complaining, there is a problem.
The clinical officers' strike has also been felt in other parts of the country, with hospitals either turning away patients or simply staying shut. The clinical officers' union leaders met with the PS for Health, Mary Mudhoni, alongside other senior Ministry of Health officials on Monday, with the view of hearing the officers' plight. Doctors, on the other hand, who started their industrial action nearly 3 weeks ago, maintain that they will not go back to work despite what they say are threats by the national and county governments, as well as the management of some referral hospitals. They say their return to work will be informed by the resolution of their concerns, including the posting of interns and their remuneration, the implementation of the 2017 CBA, and addressing the acute shortage of doctors in the country.
And therefore, there's no way, as chair of COG or as Council of Governors, they will demand doctors to go back to work when none of these issues have been resolved. We are saying that all the doctors, including the doctors of Kirinyaga, will be out until the issues that we have put forth are resolved.
The doctors will hold a demonstration on Tuesday in Kisumu, bringing together medics from Kakamega and Kisumu counties. Clinical officers, on the other hand, are also set to demonstrate in Nairobi as their strike continues. Brenda Wanga, Citizen TV.